Right, let's take that story further and tell you that the medical fraternity believes Omicron will likely cause very mild symptoms and are optimistic that current vaccines should hold well against the variant. For reaction, health expert Dr. Kgosi Letlape joins us now for a conversation. And Doc, we always appreciate your time and your expertise. So Omicron, defined by the World Health Organization as a VOC variant of concern. We've seen what many are saying is overreaction by certain countries in terms of the travel restrictions. In South Africa, it would seem that President Ramaphosa's take is let's stay in a holding pattern for now in as far as the interventions are concerned. VOC, how concerned are you as a medical expert?
Good afternoon to you and the viewers. To start by saying I am here as an activist rather than an expert.
Sure.
I'm an ophthalmologist, not an infectious disease specialist. But my opinion is that I have no problem with the holding pattern. My issues is about what else is not being done. We, as you've heard from the minister as well, we are preparing on the hospital side. But I hear of very little activity at a community level, at a patient level, at the prevention level. You know, tracing, testing, prevention, advising people if you have symptoms, don't go anywhere. Those issues are just as important as preparing for the hospitals. We should be having serious effort to keep people out of hospital rather than to wait for them to come into hospital. I commend the efforts of the preparedness in the hospitals, but I still lament the fact that I live in Gauteng and we haven't heard of the full opening of Charlotte Maxeke, which is one of the key institutions in provision of care in our country. We have to be concerned about this because, as Professor Karim has illustrated, the first wave, we didn't know what was happening. The second wave was driven by a variant, Beta. The third wave was driven by a variant, Delta. Now we have Omicron, which will be the driver of the fourth wave. What have we learned? The remedies that we have are still the same. The non-pharmaceutical methods remain critical and important. And vaccination is an added tool that we did not have in the first wave. So those of us that are not vaccinated, let's go out there and vaccinate. Those of us that are concerned about the people that are eligible for vaccines in our families that have not, if we're concerned about the safety of our families and we're not looking for an addition to our ancestors, we need to encourage our families to avail themselves to vaccination.
Dr. Letlape, within that then, what do you make of the message that the president, for example, drove last night about the importance of getting people vaccinated, as well as the nascent discussion and conversation around mandatory vaccination, which seems to be gaining traction beyond just government, but among the so-called social partners within NEDLEC. So the likes of COSATU, for example, saying that, they would support a situation where certain spaces, public spaces in the private sector, you would basically need to either have proof that you've been vaccinated to have access and carry out your activities, or to present a negative COVID test on an ongoing basis, perhaps even at your own cost.
I think how we communicate this becomes important. My view on vaccines is they are no different from the other methods of non-pharmaceutical medicine. We never had to go gung-ho on the fact that if you're not wearing a mask, you're going to be refused entry in certain places. And I'm encouraged by the president convening a task team about targeted mandates. I would have no problems with a situation, for example, that says, if you're a healthcare professional that works in the ICU, where you're going to interface with people that are infected with COVID, it is mandatory that everyone be vaccinated in that setting. If you're going to work on an oil rig, which is a confined space, it will be mandatory that people be vaccinated. If you're going to be on an airplane and you're going to be working as a staff member for an airline or as a passenger, it will be mandatory that you be vaccinated. And those issues would fall into the same category as what we've done with non-pharmaceutical methods. Once we begin to create task teams around it, it becomes like we gung-ho on trying to divide the society on these issues. I am not for blanket mandates that says, if you work for Discovery, you have to be vaccinated. People have to be met halfway. We have to take along the non-pharmaceutical methods. Yeah. We have to ensure that employers create an enabling environment for curbing the spread of infection. Washing of hands, sanitizing, avoiding groups, people working from home, and ensuring that we avoid group gatherings as far as possible, whether it's for leisure, for sport, for work, or in the workplace. All those things need to be done. We shouldn't make the mistake of treating vaccines like they are the new magic bullet. Yeah. They are an addition to everything else that we should be doing.
Lastly, Doc, while you're talking...
as a practitioner, before you go to lastly, remember that as a practicing clinician, we do not force therapies on people, even if those therapies are going to force their lives. Our duty is to educate. And I would like to see better effort at making vaccines readily accessible, engaging traditional healers, making every general practitioner practice a site for vaccination. It is close to the community. They see the patients. They'll bring in the people with the comorbidities, and we will go further. We need to do more in terms of ensuring that vaccines are readily and easily accessible. Take them to the people. We can't continue doing corporatization, come to the garage at the clinic, come to Discovery Center, and we keep it in the suburbs and in the towns, and we think we're going to get a different result. We got to increase the outreach of taking vaccines to the people.
Yeah, I like some of the suggestions that you make. Lastly, Doc, a lot of what you've been talking about in terms of the non-pharmaceutical interventions, that's the phrase that has been used, is in our hands, quote unquote, in that, a lot of it is individuals taking responsibility. How much room is there still for interventions that are sort of, top down in their approach? The president didn't impose any new restrictions. For example, there wasn't an interprovincial travel ban. There wasn't a whole restriction on the sale of alcohol that we used to see back in the days. And some of what he's been saying is that we were taking those measures back then as stifling our economy because the levels of vaccination were, close to zero at that particular point. But as more and more people are getting vaccinated, is there still room? He says we'll be reviewing in about a week. But these unpopular interventions that are sort of top-down restrictions on freedoms and movements and choices of people, is there still room in our arsenal in response to COVID-19 for these going forward?
There is still some wiggle room on some of those issues. But we've got to be careful about bans. There might be restrictions that need to be imposed. For example, we should be announcing that matriculants of this year, unfortunately, given that Omicron is here, they need to respect the regulations. If they are going to be celebrating, the limits to outdoor numbers should be held. They should be encouraged to be outdoor within the numbers permissible under level 1. If we can increase that to level 2, decrease the number of people attending funerals to 50, it will be to our benefit. But bans do not work. Just like we've heard that the UK was quick to ban travel, they are going to reopen travel. Bans don't work. What we need to concentrate on is how do we educate people so that they make informed decisions. We're at a point in our society where we should be taking the personal decisions to avoid gatherings. Whether they are family gatherings that go beyond the stipulated numbers in unsafe circumstances, or they are gatherings where we are invited, or we go into sports fields, we should be at a point where we should know how to reduce the impact of COVID in our lives, and we should do it as citizens that care about ourselves and about others.
All right, Dr. Kgosi Letlape, thank you for your time. He's a healthcare activist who tells me he's been confined to his house since March last year, getting out from time to time to pick up one or two essentials. Are you?
Yes, I do essential activity, but I consider myself a compliant citizen. Remember, the previous minister said that over 60s with comorbidities stay home until further notice. I'm still waiting for the further notice.
Good on you. Thank you, Doc.